Thank you, Stu, and welcome students, faculty, special guests, and community partners. We are elated to have you all here today to share our interest of interprofessional collaboration and teamwork. We hope that this event will help to enhance interest and participation in interprofessional and interdisciplinary collaborations within the University of Maryland education system, as well as among our community partners. This event is sponsored by our Committee on Collaboration, Interprofessional, and Interdisciplinary Education Strategies, also known as CIPES. This committee was developed at USG to promote excellence in education through interprofessional and interdisciplinary collaboration and scholarship, and to assure that universities at Shady Grove students are exposed to the knowledge and skills to engage collaboratively with other disciplines and professions to provide high-quality service to the populations they serve. We do so by creating and implementing collaborative didactic coursework and laboratories, community outreach, and scholarship innovations. Today's activity is not only a demonstration of interprofessional collaboration, it is also a teaser for a new interprofessional elective that will be offered this fall here at the universities at Shady Grove through CIPES, entitled Interprofessional Approach to the Critically Ill Patient. This class will provide in-depth exposure to and experience with aspects of healthcare for the critically ill by utilizing simulation and case-based learning while working within and maximizing strengths of an interprofessional team. This course fosters enhanced assessment and prioritization of issues related to critically ill patients, as well as communication and application of clinical knowledge and skills across the disciplines. Furthermore, this course prepares students interested in acutely ill patients to recognize, categorize causes of, and recommend appropriate treatment and intervention for sudden deterioration. This class will be available to third-year pharmacy students and senior nursing and respiratory therapy students. Additionally, we are currently exploring ways to integrate social work students into the class as well. For today's simulation experience, we are honored to have University of Maryland Baltimore President Dr. Jay Perman participating, with nursing faculty Pam Shoemate, nursing student Domingo Baez-Diaz, nurse practitioner student Danielle Warren, pharmacy student Ashley Vines, and respiratory therapy student Haptam Aleyu. More information on each of the participating individuals can be found in the program that you received when you entered the auditorium. I would also like to thank the planning committee for this event and the interprofessional course being developed, including Jeff Gonzalez, Adriana Guerra, Robert Joyner, Mary Pat Ulisny, Pam Shoemate, Rebecca Wiseman, Karen Clark, and Kevin Harris, as well as Troy Williams and Stu Murphy for providing AV and IT assistance, and Aaron Shrapati, Joe Busey, and Bill Schlossenberg for developing the program and marketing materials. Following the simulation exercise, Dr. Perman will be giving a special presentation on interprofessional education and its importance in the education system. Following his presentation, refreshments will be served in the corridor outside of this auditorium. At this time, I would also ask that you please put your cell phones and other devices in the off position so that we do not have interference with the technology that is on the stage. Thank you again for coming, and I hope you enjoy the show.
Let me give you a report on the patient you're going to be taking care of today. Okay. I have all of his information pulled up over here.
All right.
Okay. You're going to be taking care of Mr. John Thomas. He's a 19-year-old college student who just arrived to our unit about an hour ago from the PACU. Mr. Thomas was in a motorcycle accident earlier today. He spun out on the Beltway. He was going about 40, 45 miles an hour when he did.
Well, I'm glad he's okay now.
Yeah. He suffered a really complex right ankle fracture. He also fractured ribs 3 through 8 on the right side as well. Preoperatively, Mr. Thomas was stable but in tremendous pain. PACU staff said that in the OR, anesthesia used isophorane, fentanyl, and midazolam for his anesthetic agents. And then immediately post-op, they started him on a dilaudid PCA. And you can see here he's on a continuous and bolus. It's 1 milligram per milliliter. He gets a continuous rate of 0.5 milligrams an hour, on-demand rate of 0.5, lockout of 10 minutes. Okay, he's still having, his pain score was about 4 last time I checked with him, okay? His vital signs have been stable since he's been back here. He's got a dressing on his right ankle. That is pretty dry. Here, let's take a look at it while we're doing report. Mr. Thomas, I'm just going to show Domingo your ankle here. His dressing's nice and dry. You see he's got good pedal pulses still. Foot's nice and warm. He's got his immobilizer in place. Okay. Prior to this accident, he has no past medical history except for usual childhood illnesses, no past surgical history. He is 88 kilos, no known drug allergies. His blood alcohol level in the emergency room was 0.168.
Oh, okay.
Okay? You have any questions for me?
What about respiratory? Everything is fine?
Everything has been fine so far.
urine output
Yeah,
is
here's the
fine.
last set of vital
Okay,
signs.
so he's stable.
Yeah, he's been stable so far. He's only been back for about an hour. I haven't had a chance to get him cleaned up or anything yet.
Okay, I'll take care of that this morning.
Okay.
Well, hope you have a good day.
Okay. Mr. Thomas, I'm going to be going home now. I'm going to leave you with Domingo. He's going to take really good care of you, okay?
Okay, thanks.
Have a good day.
Okay, Mr. Thomas. My name is Domingo Baez. I'll be taking care of you today, your nurse. So how are you feeling so far?
Oh, not too bad. I'm still in pain. My leg hurts pretty bad.
Can you tell me how's your pain right now? Can you give it a number from 0 to 10?
Probably like 6.
Like 6? Okay, have you been using your PCA pump?
Yeah, they explained it to me when they hooked me up to it.
Oh, okay. Just continue using the pump. That's going to help with the pain, okay? What I'm going to do, I'm going to check the equipment very quick. I'm going to do a quick assessment, and then I'm going to get you all cleaned up, okay?
Okay,
Let me
thanks.
place this down. Let me take a look at the PCA pump. Okay, so everything is fine there. We have the normal saline running. So I'm going to get some gloves on so I can do your assessment.
Okay.
All right, Mr. Thomas, the first thing I'm going to do, I'm going to listen to your lungs and heart, and then I'm going to check your right ankle.
Okay.
So can you take a deep breath for me? Everything sounds good. Do you have any nausea or vomiting since
Oh,
you're
no.
Or no?
No.
Do you have any abdominal pain?
Nope.
No? Okay, let me take a look at your pulses. Good, everything is looking good. I'm going to take a look at your right ankle.
It's a little,
Can you wiggle your toes for me?
yeah, that
Okay.
hurts.
Painful?
Yeah.
Okay, let me check the pulses.
Ah,
I'm going to take a look here at your dressing. Well, everything is nice and clean.
ow.
All of these pillows and sheets are all wet. So what I'm going to do, I'm going to ask one of the nurses to come and help me. We're
Okay.
going to get you all changed and cleaned up, okay?
Okay, thanks.
Oh, hello, Domingo.
Hey, hi, Daniel.
How are you?
Oh, here is Mr. Thomas.
Mr. Thomas. Hi, Mr. Thomas.
Hi, how are you?
I'm good. My name is Danielle. I'm the charge nurse here today.
Okay.
Very nice to meet you.
Nice to meet you.
Good. How are you feeling?
My leg hurts a bit, but other than that, I'm glad to be here.
Oh, good. Well, you definitely have a good nurse taking care of you today.
Okay.
All right, great.
Well, the plan is to get him all cleaned up. He was
Okay.
transferred from the PACU, and he still have his old sheets from the OR. And
Okay.
Everything is wet and dirty.
Okay, great.
So, Mr. Thomas, what we're going to do is we're going to get you all cleaned up. We're going to change your bed and everything. But I need you to press the button on the PCA so you can get some pain relief while we're doing all of this. So
That sounds like a good
here is
idea.
the PCA pump.
Okay.
So what we're going to do, we're going to turn him towards you.
Yeah,
and
sounds
then,
good. All right.
do-
Grab this stuff here.
Mr. Thomas, how are you doing?
Um,
Mr. Thomas?
Mr. Thomas,
Mr. Thomas.
can you talk to us, Mr. Thomas?
Vitals doing?
Oh, he's deciding a little bit. Mr. Thomas,
Okay, he's not
oh,
responding.
he's not responding.
All
Let
right,
me
I'm
go
gonna
ahead
call
and
rapid response.
put him on the mask. Mr.
Hello,
Thomas,
This is Danielle. I'm calling from 4 West. Yes, I'd like to call a rapid response to room 301. Yes, 301. Thank you. Is he responding?
no, he's not responding. Mr. Thomas, he's still deciding. I mean, I got him on 100%. So you, okay, thank you. Mr. Thomas, Mr. Thomas?
Hi, I'm from Respiratory. I was responding to the code.
Hi, Mr. Thomas, he was stable, but he pressed the button on the PCA. He's not
Okay.
responding right now. He's breathing really slow, and his stats are in the 80s. They're
Okay.
dropping, so
He's
I go-
breathing solo, so we are gonna back ventilate him.
Okay, let me help you with the BVM. Here's the BVM.
Thank you.
Hi, I'm Ashley. I'm from pharmacy.
Have you attached it? Thanks.
Yes. Hi, actually. My name is Domingo. I'm taking care of Mr. Thomas. He was
I feel-
stable the whole time.
I feel
He
resistance. Can
pressed
you give
the
me
button
oral
for the
here with
PCA, and
ice?
then he became
Thank you.
unresponsive. And right now, he's being bagged because he's not breathing on his own.
Okay. Have you turned off the PCA?
No, Bunny, can you turn off the PCA for me, please?
Absolutely.
Thank you.
All right, it's off.
And did you want to give naloxone?
Okay. How much you want to give the Narcan?
He's 88 kilograms, so we can give him 0.4 milligrams IV
Oh.
push.
Can you give me the 0.4
Yes.
milligrams of Narcan? He got a good IV access here.
All right.
Mr. Thomas, he's still not responding.
Okay.
Okay.
Can you make sure his oxygen is? Okay.
Okay. So the Narcan is in already.
Okay. It's good now.
And we can continue to monitor him. We might need another dose in about 30
Okay.
minutes based on his clinical response.
Okay.
That's
Mr.
good.
Thomas.
Do you
he's
hear
still
breath
responding.
sounds? Oh, good. He opened his eyes.
Oh, good. Excellent.
Mr. Thomas?
He's clear. He's breathing on his own now.
Mr. Thomas, can you hear us?
Yeah.
Pulse ox is 100%. Okay.
Excellent.
We're gonna sit him up.
Good.
He is breathing spontaneously, so I'm gonna place him back on nasal cannula.
Okay.
All right.
Yes, he's doing fine now. He's at 99%.
Very good. We're glad you're back with us, Mr. Thomas.
How are you feeling right now, Mr. Thomas? Are you still in pain?
Yeah, I'm still in pain, but what happened?
Well, you pressed the button on the PCA pump, and your body became a little sensitive to the medication, so you become unresponsive. We have to back you, or basically breathe for you. But it was less than a minute, and now you're stable. Your vital signs are stable. So it's nothing to worry about at this point.
Oh, great. Thanks.
He's still in pain.
Mr.
and
Thomas, I'm putting
we
the nasal
basically cut
cannula on your
everything with the
nose.
Narcan, so
Okay.
what will be the plan for now?
Well, after looking at his chart, it looked like he had a very high dose of his PCA combined with some residual anesthesia, and he had an alcohol level on his admission, so we can discontinue his basal rate and maybe decrease his bolus rate to around 0.3 with a higher lockout, 15 to 20 minutes.
Can we place in tidal CO to monitor to
Yes,
evaluate
definitely.
his
we can
ventilation?
do that. Do you want to put him on anything PO?
For now, we can just go with the decreased bolus, but maybe transition him to something PO like oxycodone later.
Okay, okay.
I think Dr. Perman's on his way, so we can discuss the case with him.
Okay, sounds good. Mr. Thomas, what I'm gonna do, I'm gonna stay here in the room with you, so to make sure that everything is fine, okay? So let
Okay.
me know. We're gonna give you something for pain again.
Okay,
It's gonna be a
thanks.
lower dose to make sure that you're doing fine.
Okay, thank you.
Hi, everybody.
Hi, how
How
are
are
you?
you?
sir?
Good.
This looks like a very good team.
Oh, yes, sir. Mr. Thomas here, he was transferred from the PACU. He's on a PCA pump, but apparently he was too sensitive to the dose, and he became unresponsive. But now he's stable. He's sitting at 97 to 100%. Vital signs, blood pressure, everything else is stable at this point.
Mr. Thomas, how are you?
Oh, pretty good now.
I'm glad to hear it. Tell me a little bit about yourself. How old are you?
19.
19. And do you work? Do you go to school?
I'm a student down at College Park.
Oh, is that right?
Yes, sir.
Terrific. So what happened to you today? Were you traveling somewhere?
I was on the Beltway and zigged when I should have zagged. And,
Zigged when you could have zagged, huh?
yeah.
Yeah. And what happened? Do you remember anything about it?
I remember losing control, and then next thing I know, they brought me here.
Do you remember what you were doing before you went out on the Beltway?
I might
Why
have
don't
had
you tell
a
us
few
about it?
beers. Yeah, I might have had a few beers with my buddies.
Just 2 beers? Maybe a few more than that?
Maybe a few more.
Maybe a few more. It's easy to lose count, isn't it?
After 3, yeah.
Yeah. Is drinking something that you do every day?
No. Usually, when I get together with my friends.
Well, we're going to have to talk about that when you get all healed up, aren't we?
Yeah, you
Because
and
you don't
my
want to
parents.
be
Yeah.
coming back here on a regular basis, do you?
No, sir.
No, and banging up your motorcycle.
Yeah.
Tell me a little bit about your family.
Well, my dad's an engineer. Actually, my mom's a nurse, and yeah,
Have
we've
they been in
lived
to
here
see you yet?
They're on their way.
Okay, well, I'm glad of that. Let me, while we're standing here around you, let me ask just a few questions, and then we want to talk as a team and try to figure out how to make sure that you have a nice, stable situation here while you heal up. Do you have any problems with breathing right at the present time?
No, just...
You feel that you can breathe easily?
Yes, sir.
I know that there was some issue with regard to his ability to ventilate. I know that he desatted.
Yes, sir.
And I think, Ashley, that you're absolutely right. The most proximate cause is his response to the PCA pump and the medication. But are we pretty darn sure that with his injuries, he doesn't have a pneumothorax? Do we know he has a normal chest x-ray other than the ribs?
He got an x-ray this morning. We don't have the results yet, but he got some fractured ribs, so that's definitely...
Yeah. So, you know what? I don't think we should wait for the results to come up. I'd like, when we get done talking, that somebody check on the film. Ideally, we should look at it together, just to make sure that there isn't any issue in terms of a pneumothorax that may have contributed to what happened here. Maybe he's got some problems ventilating. How about belly pain, Mr. Thomas?
No,
Any?
none at all.
None at all. And he seems to have a soft abdomen. You know, one of the things I always worry about with bite-type injuries is the possibility that he could have what kind of an injury? With a
internal injury.
yeah, and what specifically? What organ am I worried about?
Basically, his liver. He can bleed in if he
Well,
got
we
an
could
injury
worry
to his
about the
liver,
liver,
any
but
injury.
particularly with handlebar injuries. Your motorcycle, got a big handlebar sticking out, sir?
Yes. Yes.
Okay. Well, so what if a handlebar comes right in here, where I'm pointing here? Yeah, so he could have a splenic injury, and spleens are fragile, and they bleed easily. So we'd like to make sure, given what's happened here, that he's not likely to have a splenic injury. You know, when he came in, he may have had appropriate imaging studies in order to make sure that there wasn't any, but in view of what's happened, I'd like to make sure that we're not overlooking something. Do you think he needs to be intubated because of what happened here?
Not at this moment. If he's stable and he's okay, I don't think there's a need for him intubation yet. But if we place the end-tidal CO2 monitor, we can see his ventilation status as well.
So if he accumulates CO2,
Then
you'd
maybe-
be rethinking that?
Yes.
Yeah, would you two agree?
Yes.
You
Okay.
can send an ABG to check.
Yeah,
Yeah.
that's a good
We
idea.
can do
Yeah,
that
to
too.
get some blood gases.
We can
I think that would
definitely
be.
do that.
Have you done that?
I haven't done it yet.
That's a very good idea.
Okay.
I agree with that. So I do suspect the PCA pump's dilaudid.
It's dilaudid.
Yeah.
Yes.
So he may be very sensitive to it, huh? What's the idea of the Narcan? What does the Narcan do? Does everybody on the team know? Can you tell us, Ashley?
Sure, the Narcan or naloxone is the generic name. It's an opioid antagonist, so it can counteract the effects of the high dose of Dilaudid that he was getting.
Yeah, and it certainly seemed to reverse
Basically the
his,
whole-
reverse, I mean, his SATs came up, his heart rate came up, it was beautiful. So what do you recommend? I heard that, I think what you were saying as I walked in is that in terms of what's dripping constantly, we ought to turn that down and maybe let him increase his bolus size. Is that what you thought?
What we were actually going to do was discontinue the basal rate completely and use only a bolus.
So there's no basal rate, there's no drip, and just use a bolus. Is there any reason to think about using an alternative medication? What do you think?
With a lower dose of this medication, you know, he was on a very high dose with his lockout rate combined with his basal. He was getting maybe 4 milligrams max of Dilaudid per hour. So we were going to try to decrease how much he gets in an hour of the Dilaudid.
And you're probably thinking that this all happened layered on to the meds that he got in the PACU. He probably got some anesthesia meds in the PACU, which are probably still on board.
Along with the alcohol on admission that could
Yeah,
potentially
that's a very
be
good
effects of any
point.
of those.
Yeah, that's a very good point. So maybe if none of that had been there, he would have done fine with the
Yes.
Dilaudid. But maybe given everything that he came in with and everything on board, he was super sensitive to Dilaudid. Does he need more Narcan, Ashley?
Well, based on his response, Narcan does have a pretty short half-life.
So you got to give it again?
So we wanted to continue to look at his clinical response, and then if he did need it again, maybe in 30 minutes, we could give another dose.
All right, good, good. So listen, Mr. Thomas, it sounds like you're well on your way to getting healed. Those broken bones are going to take a little bit of time.
Okay.
But remember what we started talking about, because we're going to need to talk about it every day. You know, something like this, accidents happen, but sometimes it's easier to have an accident if you're not completely clear in your head. And those beers, not a good idea.
And I know that now.
Right?
Yes, sir.
Okay. That's much more important than anything else we're doing here today. What's important is how you change your lifestyle a little bit. Okay?
Okay, thanks.
All right, that's the deal. All right, very good, team.
Okay, thank you, sir.
Thank you.
All right, Mr. Thomas, we will see you.
Be well.